Hello everyone, welcome back to 48 Now. I'm your digital host, Tatiana White, and I am here today with Dr. Vick DiCarlo from Alabama Colon and Gastro. How are you doing today?
I'm doing great. Thank you so much for having me.
Yes, thank you for coming. And so March is Colon Cancer Awareness Month, and that's a time dedicated to educating people about the importance of early detection and screening. Colon cancer is one of the most common cancers in the U.S., with about 150,000 people being diagnosed in the U.S. every year. But with early detection, it is also one of the most preventable. So today I'm joined by Dr. DiCarlo to discuss more about the importance of Colon Cancer Awareness Month. And so can you just introduce yourself a little bit and tell your role at the Alabama Colon and Gastro?
Yeah, my name is Vick DiCarlo. I'm a gastroenterologist here in Huntsville, Alabama. Working over at Alabama Colon and Gastro. Myself and my partner, Dr. Rice, and we have a wonderful team over there with extra staff, nurse practitioners, PAs as well, and we work really hard to help take care of our patients.
Yes, awesome, and we thank you all for what you all do. You guys have a very important job. So.
Thank you.
And so why is Colon Cancer Awareness Month so important?
It's really important because we've been able to develop guidelines that help prevent colon cancer, and if we can get the message out to help follow those guidelines, we can really drive down the incidence of colon cancer. And so it's really important for colon cancer prevention to be on the forefront of the minds of other medical providers and other people in the community as well.
Yes, absolutely. And so can you describe a little bit about what exactly is colon cancer? How does it develop?
Yeah, so that's a great question. The main thing is that inside the colon, there's normal tissue and then there's abnormal tissue. The abnormal tissue will oftentimes can develop into precancerous lesions, and then those precancerous lesions can then develop into cancer. And the idea with colon cancer prevention, or colonoscopies in particular, is that you take a good look, and if you come across those lesions or those precancerous polyps, you get those removed, and you decrease the chance of colon cancer from arising from the colon.
Wow. Okay, I didn't even realize all of that goes into it. So, and so, what are like some of the risk factors for colon cancer?
Another great question. The probably main risk factors, which plays into when we start colonoscopies too, is genetics or family history. So patients that have first-degree relatives with colon cancer, we start screening at an earlier age. But other things as well, which is where there's a lot of research actually looking into this right now, is that there's a newer entity of young onset colon cancer. And we're finding that 10% of the colon cancers that are actually diagnosed right now are in patients under the age of 50. So that's a big number. And I think there's probably a lot of environmental triggers as well. So we know that obesity, diets that are high in red meats, low in fruits and vegetables, so low in fiber. Smoking is bad across the board, but smoking definitely increases the risk of colon cancer. So it's really important to pay attention to your own risk factors, whether it's family history or some other environmental and other medical comorbidities that can help put you at risk for colon cancer.
Yes, and so for people who, if it's like family, how would they kind of go about seeing if that history is there for them?
Yeah, so that's one of the nice things about us coming here and talking about this and having a month dedicated to colon cancer awareness, is that it reminds people to, hey, talk to your parents or your siblings and say, have you had your colonoscopy? Did you ever have bad polyps, or do you have a history of colon cancer that you survived from? Because if you have that, then you should at least be getting a colonoscopy at the age of 40. If that family member had a colonoscopy or had a colon cancer sooner than that, then you might need to get a colonoscopy sooner. So it's just really important to know your family history, particularly when it comes to colon cancer.
Yes, absolutely. And are there any like symptoms that people should be aware of, or anything that like people kind of that you've noticed that people ignore that are symptoms that they should be aware of?
Yeah, the big thing with colon cancer, and I have this conversation all the time, is that the reason why we have a screening regimen is because colon cancer is silent. And by the time it is symptomatic or it's causing problems for you, It may be too late. Sometimes we get lucky and I can remove it while I'm doing the colonoscopy. Sometimes we need surgery, or sometimes we need chemotherapy, radiation, all these other things. But it's really important, especially if you're not of the age, so say 45 for your colonoscopy, to pay attention to symptoms like change in bowel habits, blood in your stool, you're more constipated, or your belly's hurting a lot more, or you're having weight loss and you don't know why you're losing weight. So these are all things that you certainly need to talk to your primary care provider or come to a gastroenterologist's office and have a further discussion about.
Yes. Okay. And so what age do people usually start to get screened? Because I know, like you mentioned, I was researching and saw that a lot of younger people now. Is there like a reason why younger people, or is that still a part of the research?
That's a great question, and it's something that I'm looking forward to hearing back from research. I think some of the early studies are showing there's probably environmental factors, dietary things, maybe some stuff that's in our food and our drinks, or obesity is a big problem in America as well. So these are all certainly risk factors that could be contributing to the early onset colon cancer. But if you are average risk, no family history, no symptoms, you really should be getting colonoscopies at age 45.
Okay.
And if there are other risks, it's going to be at least 40 or even sooner, depending on some family history.
Wow, yeah. So do you usually see people like in their 30s, 20s, or is that usually just dependent on like family, most likely?
We have a lot of younger patients that come in and say, "Hey, doc, my stomach's hurting me. I see blood every once in a while," and it might be a very benign, meaning not cancerous thing that's going on. But my goal a lot of times is to, hey, I know that there's this thing called young onset colon cancer, and if we can do a colonoscopy to either one, reassure ourselves that there's nothing bad going on, or two, catch colon cancer early, we can move the needle and really help hopefully prevent some of those cancers.
Yes, that's awesome. And so how effective would you say like early detection is to like prevent severe cases from happening?
Oh, it's amazing. So I mean, you did a wonderful introduction saying that, and I think in 2025 we are expecting to make the diagnosis of colon cancer in 150,000 people at least, and then I think about 50,000 people are expected to pass from colon cancer. Unfortunately, the incidence or the number of diagnoses and deaths from colon cancer have decreased over the years because of our screening methods. And so we've done a good job of that, but there's a huge population of people that we are not able to reach, whether that they don't have the access to the health care, or the health care is just infrequent, and so we are still missing people. And it's a very I know we're doing a good job, and it's very important that we're having these conversations in March every year to hopefully continuing with that push to continue colon cancer screening.
Yes, and you made a really good point about the infrequent visits. I know some people, especially I know a lot of the time men, or people that are older can be a little hesitant about going to the doctor and stuff.
Sure.
So what would you say, I guess, to encourage somebody that's I'm not sure, or they're nervous about finding out if they do?
Yeah, so I have this conversation a lot because a lot of times I'm seeing patients, they're just now getting established with their primary care. Some people will have no medical problems, and it's 45 and they're seeing the doctor for the first time, and they come to see me, and I'm talking about maybe their first surgery, their first procedure, anesthesia, and they're very nervous about this, and it's my job and my colleagues across the field to provide a lot of reassurance. It's like, hey, look, colonoscopy is very low risk procedure. We do this all day, every day. We talk about these things all the time. You don't need to be nervous about it, and we'll take good care of you. And if we can follow these guidelines, and hopefully, we say, if I have a 5-minute conversation with you, we get your colonoscopy, and never see you again for 10 years, that's a good thing.
Yeah.
Because that means you're doing good and we've done our job here.
Yes, and that's awesome. I think sometimes people just need that reassurance from the doctor themselves that they're going to be okay. So,
Absolutely.
And so quite a lot of celebrities I saw have been having colon cancer, especially a lot of younger ones. And so why do you think, or how do you think public figures, like that awareness that they're bringing, how does that kind of help, do you think?
Yeah, I think probably the two of the notable ones is that Chadwick Boseman several years ago, and then James Vanderbeek. Boseman, I think his colon cancer was diagnosed at age 43. I don't know if he had family history and all that stuff, and so it's one of those younger onset colon cancers, which is obviously very concerning, and that's a sad story. But I think it's very important when these high-profile figures are vocal about this. It goes hand in hand with, a news station reaching out to a local gastroenterologist to say, hey, talk to your doctor about any symptoms. Am I of the age to get screening? Because a lot of this is very preventable, and if we can use social media and news to reach out to patients that have maybe never thought about this, I think we grab a lot of good people. I know comedians have kind of, videoed themselves getting a colonoscopy, and there's a lot of funny things about a colonoscopy, right? There's the bowel preparation, and there's the anesthesia, and so if you can make light of all of it, I think it gives a lot of ease to a lot of people.
Yes, and I think if you see like your favorite celebrity or somebody that you look up to, and you're like, okay, if they can do this, I can do it. It's fine. So.
Yeah, definitely.
And so, what can people do, or is it possible for people to lower their risk of getting colon cancer?
Another great question. A lot of it goes hand in hand with living a good, healthy lifestyle. Unfortunately, there is a lot of genetics associated with this, but it's the same thing. Patients asking me about a good diet and are there any supplements they can take, and the main thing is we're trying to live a good, healthy lifestyle, and so that's your consistent, high fiber diet, diet that's low in red meats. Your meats and proteins maybe need to be fish and chicken that's not fried, and have a good, healthy caloric intake, maintain a good, healthy weight. So it's a lot of things that your cardiologist or your lung doctor, your primary care is going to be telling you too. And I find myself being another provider, just being another patient advocate, and say, hey, we can do this together.
Yes, absolutely. And so how can our audience take action through this awareness month just to take care of themselves?
Yeah, great question. The big thing is, all right, some of us, we forget how old we are sometimes. We think about it, oh, I'm 45 next year. Do I have a primary care doctor? No, I'll get established with my primary care doctor, and then talk to that one and say, hey, can I go see a gastroenterologist for colon cancer screening? Or talk to your family members, see if they've had lots of polyps or if they've had colon cancer. So it's a time to reflect on your own health and your family's health to see if you personally are at increased risk for colon cancer. And then your medical providers can assist you. The big thing is we just got to get you in the door so we can have that conversation. We're always happy to have that conversation.
Yes. And where can people go for more information or learning how to schedule some type of colonoscopy, or if they have never really done a doctor's visit, how would they kind of go about doing that?
Yeah, that's a good question. Primary care offices are always helpful if you're trying to navigate to get to a specialist like a gastroenterologist. A lot of offices, including ours at Alabama Colon and Gastro, we have a patient portal where you can send in a request to get an appointment. You can Google from that standpoint. If you're just trying to learn about colon cancer, there's coloncancer.org, which has a lot of good information about the rates and what to expect and what symptoms to be worried about. And then the big thing is, it's easy to research a lot on the internet, and then you go down the wrong hole. If you have any questions about your medical history, your medical provider, including myself, happy to have that conversation. That's the big thing. I can walk you through the whole process.
Yes, and thank you for saying that, because
Yeah.
I know it's like, especially in this generation, like we can get on these rabbit
Sure,
holes on
sure.
like social media and on Google, and then you're like, oh my gosh, I'm dying, and
Yeah.
it's like that's not even the case. So, and so, what's one key takeaway that you want to tell people to remember about colon cancer and just their health in general?
Yeah, I mean, the first thing is colonoscopy save lives. Know your family history and come and see us if you have any questions. That's the biggest thing. The other thing I tell my patients all the time is, you know your body better than I know you. If you feel like something is off, be your own advocate in your own health and bring up those questions. It's my job to listen and see if there's something concerning. If we're concerned together, we do further workup and we figure out a solution to either your issues, or we try to make sure there's no cancer, or or treat whatever might be going on.
Yeah.
It's important in today's busy lifestyle, to be your own patient advocate and find the right providers that will listen to you and sit down and see what we can do to work on things.
Yes. Well, thank you so much.
Yeah.
And is there any final messages, anything we might have not touched on that you would like to share?
Not necessarily. I really appreciate this opportunity coming here. It's great that we have March as a month to really reflect on colon cancer, which is a top cancer in the world, and if we can do anything to help prevent another person from getting colon cancer, I'm here for that. So I appreciate your efforts with us as well, and if you have any questions, come see us.
Yes, well, thank you so much, Dr. DiCarlo,
Yeah.
and thank you for all that you do. I know, it can be an intense job, but we thank you for you and your staff and everything that you guys do. And so thank you all for joining me today and for joining 48 Now. And be sure to take care of yourselves, be aware of the signs of colon cancer, and stay up to date with your health. I hope you all have a great rest of your day.
All right. Thanks, everyone.